President Trump's so-called big beautiful bill clears the Senate, and researchers warn several local hospitals could close because of cuts to Medicaid programs like TennCare. Welcome to News 2 at 4. I'm Tori Gessner.
And I'm Kendall Ashman. The Tennessee Justice Center calls the president's spending bill a wrecking ball about to be dropped on Tennesseans. Just up the road from News 2 at the Tennessee Justice Center.
I've been representing low-income Tennesseans for 50 years, and my work has primarily focused on access to health care and Medicaid.
Gordon Bonnyman says access to health care in Tennessee could drastically change. Today, the Senate passed its version of the so-called Big Beautiful Bill. According to the Congressional Budget Office, it includes more than $1 trillion in cuts to Medicaid programs, like TennCare, over the next decade.
I mean, it is terrifying to see what's about to happen, and folks don't have a clue.
Researchers at the University of North Carolina at Chapel Hill studied how many hospitals could close after a request from Senate Democrats. They found 9 in Tennessee are at risk, including hospitals in Lebanon, Smithville, Sparta, and Woodbury.
Hospitals have become increasingly reliant on Medicaid to stay open. And so now we're pulling the Medicaid leg out from under the stool.
The White House press secretary called reports that rural hospitals might have to close because of the bill untrue.
So this bill strengthens Medicaid. It will protect those benefits that hardworking Americans need, and that's why the president wants this bill to pass.
Gordon says we could see a domino effect if the bill becomes law.
If you lose the hospital, the doctors and nurses move away, the pharmacy is no longer financially viable, and the nursing home is in trouble.
News 2 asked the governor how these cuts could impact Tennesseans.
My initial response is that states will need to respond to whatever the federal government does in this piece of legislation to take care of our constituents.
But Gordon says people who rely on Medicaid won't be the only ones impacted here in the state.
Do you think it's safe to say that if, this bill passes, we're going to see a health care crisis here in Tennessee?
There's no question there will be a health care crisis in Tennessee.
In a statement from Vanderbilt, they write in part saying we remain committed to the communities and patients we serve. We have no plans to close any of our regional hospitals. The Senate's version of the bill now heads to the House for a vote.